Hi, I'm Ken Cutbush. I'm an orthopaedic shoulder surgeon working in Brisbane. I'm going to talk to you about the risk potential complications of reverse total shoulder replacement surgery. So what we're talking about is this. This is an x-ray of a patient who's had a reverse shoulder replacement. It's called a reverse because instead of a ball, we take that off and we put a socket on this side, and on the socket side, we put a ball. So the ball and socket are reversed. In Australia, 80% of all shoulder replacements are now reverse, and in our joint registry, the reverse shoulder replacement outlasts all the other options. Now, when we're talking about risks, what I explain to patients is this is a significant operation. It's like a hip or a knee replacement, and there are risks. The risk of infection is around 1%. There's a risk of dislocation around 1%. There is a risk of prosthesis loosening, of course, or wearing out. These prostheses reasonably last probably 20 years, and I think that's reasonable to consider. DVTs, hematomas, wound issues, all of those things can happen. And there's also an anaesthetic, so there's risk from the anaesthetic itself. Now let's put some science behind that. These are three scientific publications to consider. If you scan the QR code, it will take you directly to that publication. So we're talking about the Australian Orthopaedic Association National Joint Replacement Registry. It's a very prominent registry in the world, and it is well thought of and highly regarded. And the latest publication is 2024. You can see the same data that I see. If you scan that QR code, it will take you directly to that data. It's very interesting to look through. These are two systematic reviews or meta-analyses, and they're helpful to look at. So if we look at Smith 2024, so that's this QR code here, they looked at 34 studies and reviewed them. 4,127 patients were included in that review. They found an infection rate of 3%. Instability and dislocation, 3.3%, and then issues such as acromial fracture, stress fracture, 1%, neurovascular injuries, 1.3%, and mechanical loosening, 3.3%. Villasis in 2016 looked at a hospital database of 1,054 patients, and they reported an infection rate of 6.74%, which I would say is quite high. Instability and dislocation was 5.5%, hemorrhage 1.52%. They didn't identify acromial stress fractures in this group. They certainly do occur, however. And neurovascular injuries, 0.19%, and mechanical loosening, 3.42%. Now, if we look at the Australian Orthopaedic Association National Joint Replacement Registry, they have 14-year data. That is 57,350 patients. And at 14 years, 6.7% have been revised. So it means that 93.3% are still in place and still functioning. Now, if we look at the reasons for these shoulder replacements being revised, so not complications early on like we're dealing with here, this is down the track, and why did the patients have to have revision surgery? Well, instability was 30% of those cases, infection 25.8% of those cases, loosening 16%, and fracture 10.9%. Now that is an overview of the risks and potential complications you need to consider when thinking about having a reverse total shoulder replacement. Thank you for listening.